Recording in progress.
Hi guys, welcome and thank you guys for being here. My name is Donna Chow and I'm your host and your moderator for today's eLotus webinar. eLotus is your provider, your leading provider of continuing education for acupuncturists. Today's webinar is Understanding Jimmy Chang's Clinically Proven Formulas, Part 4, presented by Dr. Jimmy Chang. There are a total of 6 classes and today being the 4th one with formulas to strengthen and tonify the body. Today's webinar will be from 2:30 to 4:30 p.m. Pacific time, and we will have one break. If you have not done so already, please get your copy of the lecture notes from the Blue Course Access page in your account. If you'd like to join the chat, please set your chat preference to everyone so that we can all see your response and be part of the conversation. And finally, if you have any questions for Dr. Chang, please type them into the Q&A box in your Zoom control panel. And the quiz and the video replay. The quiz for CEUs and the video replay will both be available tomorrow afternoon, and I will send an email out when that's ready. Our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique herbal combinations. You will learn about a range of herbs for pain relief, as well as how to identify the pulse indications associated with specific conditions and how to prescribe a unique herbal formula for your patient. There is no need to reinvent the wheel. Take what has worked through Dr. Jimmy Chang's clinic and see results in your practice. Dr. Chang has previously taught numerous courses with us, which is now available for purchase as distant learning CEU video courses. Dr. Chang is the person to learn from if you want to be able to feel a patient's pulse and come up with a custom formula for the reading. If you want to cultivate your pulse diagnostic and herbal skills, he is the person to learn from. When I return to my computer, I will post a link for you in the chat room. Now let's begin today's class and welcome Dr. Jimmy Chang.
Hi, can you hear me now? Hi guys, it's me again. Today I'll be talking about some kind of kidney conditions. The definition of kidney have two different meanings. First is the Chinese kidney. That means the hormone and the reproductive system and anything about sex or whatever. And the second part of the kidney is the real kidney, is in the urination system. We'll be talking about both. Just you will see what we'll be talking about today. It's going to be very interesting. And we're going to kidney, and pulse size. About the pulse, I got something really interesting here. It's okay. Yeah, this one has 4 buttons. Of course, we only need 3. The good thing is that the spring down here is adjustable, so you can adjust the strength and the rebound of the spring underneath. So this one is the strongest, this one is the weakest. So when you press down, you find this is a hook pulse, remember? And you turn around and like this. This is a reverse hook, and this may be the kidney, and with a strong rebound, and this is the weak heart. There's liver, and then this is the so-called like a reverse hook. So this is hook, and it can sometimes you can adjust the spring under it, the pressure, rebound pressure. You might find the most stronger, make it a stronger, weaker in the twin. Then the liver fire appears. See, the rebound is different, so you can get the real feeling of what the real pulse feels like. Even without me being around you, you can still adjust the spring by yourself and to get all the different pulse feelings. The rebound, the up and down, and concave, convex, or something like that. It's very interesting. Go get one. Okay. What herbs? Okay, that's in the Tina's website. Okay, first is the bone combo, and secondly is the kidney combo, white one, 6C, the kidney young formula, kidney combo number 2. So the first one is interesting. It's not directly for the kidney function. It's something for the bone. Okay, let's begin. I see not everybody has showed yet. So, okay. Let's get on with it. The first one is we call the bone combo. Hey, last time I wasn't using this one. Last time is here.
Oh, you want to draw?
Yeah.
Yeah, this is the one. You can draw.
This one?
Yeah. Yeah, you can use the same one.
Last time is something here.
Yeah. You can use a hand. We use a box too.
It's not
Not this one. Maybe no battery.
no good.
We'll use a box there.
Okay. Okay, the first one, the bone. So why do I put the bone formula here? Because bone is controlled. Bone is controlled, the bone density, the quality of your bone structure is controlled by kidney. That's actually, it's not the organ kidney, it's the hormone kidney, Chinese kidney. So in this bone formula, this for very interesting use. It's a little bit different from whatever you have used before. So we call it bone combo. Is for stabilize the fetus, for stabilize the pregnancy. A lot of people have with the problem with this or those abortion or miscarriage quite often or quite easily. Sometimes they cannot hold the baby because not only the weakness, but some kind of a hormone deficiency. The left shi, the pulse in the left shi. if you press down a little bit, like this, you press down a little bit, the left chi can be very weak and thin. This area. That means there's no blood going through to the uterus. Nothing, the mother is not supporting enough nutrition to the baby. And in Chinese medicine, we say that thin pause means constriction. Constriction means not a very open highway. Like the highway used to be 6 lanes, now it turned to only 2 lanes. Of course, it's blocked. So sometimes that's the major reason for miscarriage. So sometimes we have to use something to open it up, but we cannot use opener. You're just using something warm to make it more circulation. And this one, some of these are good for that purposes. So I use 4 herbs to combine my bone combo, not just only for stabilize the fertility, also good for osteoporosis, weakness of the tendons and the bones. How do you know it's weak? This pause is a weak pause, cold and weak. The other one is the yang wei on the left foot. If you're not familiar with what I'm saying now, maybe you should go back and check my 8 extra meridian pulses system. This is the yang wei on left-hand side. So when this area, the yang wei is very weak or something, then you know the bone is weak. And also for some elderly people, or even with arthritis or something, this is also for arthritis. If this pause yang wei in the left cun is very strong and expanding, that means inflammatory arthritis. Of course, the treatment will be totally different. And this one, if this area is very weak or something, then you know there must be some kind of osteoporosis there, especially for older people. So I use this 4 herbs, 杜仲, yes, and the Shangji Shen. There are more than one use for this group of people, herbs. First, but 杜仲 and Shangji Shen is also for high blood pressure, for weak high blood pressure, that the patient is pale and with the blood pressure high or something. Also, the circulation is terrible. 杜仲 and Shangji Shen is not only good for strengthening the bone structure, but also good for blood pressure. You can use it if other herbs are not working. So 杜仲 plus Shangji Shen is good for lowering the blood pressure. And 续断, 续 in Chinese means put them back together. 断 means broken. So it's by the name, is some kind of help to grow, the fix the broken bones. 骨髓补, 骨 means bone, 髓 means broken, 补 means tonified. So the word in Chinese is very clear, to help to the broken area to grow back to normal. So of course, we're not treating a broken joint or something, but it's also good for that purposes, especially when people after traumatic injury or twisted ankle, or some young people get hurt on the in the exercise field or whatever. You need to make the bones stronger and heal faster. You can use this for group like bones combo. And also the 续断 and 骨髓补, even this patient doesn't have any injury, no broken joints, no broken bones, still you can use this for the joint pain as long as patient is weak. How do you know it's weak? The blood pressure will be low, the pulse will be weak. Then you can use this one as a bone combo to help people grow better. I have seen a lady, his bone is like this, forearm. This is the skin. The hand. She showed me the x-rays, it's like this. and asked me if I can help it. I help her. I said, I can't, give me 3 months, because it might take 3 months to get it better. But it healed in 2 months. It showed me the x-ray, the gap was filled up. No more gap. But I just use this medicine, and later the kidney tonifying, kidney function tonifying stuff. So let me rephrase it again. 杜仲 and 桑寄生. Remember, 桑寄生 and 杜仲 for some essential hypertension, which means there's no reason for that, just hypertension. 杜仲 and 桑寄生 is very good. And put them all together just for weak bone structure or for the healing process after even have replacement, hip replacement or knee replacement, something you need to make it grow better and faster. Then you can use this. There was an incident in Taiwan lately. A baseball field was not built properly. So even on the first game, several baseball players get injured because the grass ground was not properly paced, and some small particles in there. The outside the fielder fell down on his knees, and the doctor said he needs 8 months to recover. I was laughing at that moment. Why need 8 months? The doctor said he want operated and maybe take 8 months for the player to go back to the field. I think that's ridiculous. We don't need that time. All we need is 3 months or less by using this. And of course, not only this, in the beginning, for example, the player with broken knee joints or something, it needs to clear the inflammation like by using 普银, remember my 普银, and 正骨紫金丹. Can I type here? How do I type here?
Take out the one text.
Huh?
Bring the text.
Closer?
Not even closer. Yeah, you can do this. You type your text.
Oh, here.
And then you can type here.
Oh, okay.
Yeah, just so this. Okay.
普银 is for inflammatory joint pain, arthritis, and of course, 正骨紫金丹 for all kind of arthritis. So put them together, it can, and plus this put this bone combo later and put them all together, the heel will be properly healed in less than 3 months. It take 8 months, it's ridiculous. So whenever you're treating an athlete or a student get injured from playing balls or something, you can use this one. This one is not for inflammatory bones problem. Actually, it's not for pain or joint pain or for arthritis, no. It's just for weakness or from, maybe this athlete is not weak, but we have to strengthen his bone structure so he can be healed, and even the bone condition will be better than ever, not get weaker or weaker. Because usually when people get an injury out of nothing, out of anything, injury, car accident, operation, the sports injury, whatever, the bone structure will become weaker even after the operation. So the life of athlete will maybe damaged. So by using this, you can help them put them back to the original condition or even better. So I use this for bone combo. Any questions so far? I don't know. I never used that for older patient with jaw bone loss. How to address this condition of a patient getting dental implants? Just use my my structure, my combination. Okay. So put them together. You can make the patient have better bone structure and stronger joints than ever. And of course, for the lady who has a problem with the miscarriage, you can use this plus 补中益气，补中益气汤 ，like 30%. In addition to this, okay, for miscarriage, okay. Okay, let me. Okay. Now, the second one is the kidney combo number 2. This is the real kidney, not genital area, not hormonal kidney. It's the real kidney in the urination system. For the low kidney function, kidney failure. Okay. Yeah, there's a question how to address for patients getting dental implants or to prevent loss of teeth. That's a good question because teeth is controlled by the kidney yang. And the later we'll be talking about the kidney yang formula is good for that. And also, of course, the number 1, the bone combo is also good for your teeth. Actually, I use this 骨碎补 and 续断 in my tooth powder. I mix my tooth powder with all kind of a tonifying, like 6 seeds we'll be talking about later, plus little sea salt and some kidney yang tonifying herbs like 骨碎补, 续断, and the 杜仲 and all the 6 seeds, and mix it to become a tooth powder. And you brush your teeth with the tooth powder, your gums will be strong and with no problem at all. It's not for whitening the teeth, it's for strengthening the power of the gum. Okay. Okay. Do you have any herbs advice for patients on dialysis? I have a patient who is peritoneal dialysis. Okay, I'm treating him with nerves. Any precautions or advice? Now it's coming up. The second one is for the real kidney failure. How do we know the patient is suffering from a kidney problem? Okay. Okay, first the pulse. This pulse. Like I introduced you earlier, this is very useful little toy for practicing pulse science. The pulse is like when you touch the pulse in the beginning, it's very strong. I'm sorry, it's very weak, no rebound. When you keep on pushing down, ooh, the rebound becomes stronger. When you push down all the way to the bone, the pulse disappears. Well, of course, this is spring, it won't disappear. But in real life, weak, strong, weak. Okay, can you see it? The first, gently, when you gently touch the skin, is weak. And press down, the rebound becomes stronger. And when you push down all the way, it's gone. No rebound at all. So this is the kidney pulse. And the rest of them, if you, for example, this one, if you, okay, we just need 3 of them. Push down little, no rebound, no feeding. And push down more, it's still weak. Push down more, it's still very weak. Then it's spleen, including the water retention and digestion system. If the pulse is very strong, when you gently touch the surface, strong, strong, oh, strong, stronger. That's the colon. That's the large intestine. Hey, how come it's not written here? This one is the large intestine. Okay, colon. So then you know this guy having a problem with that. Huh? So try to remember this 8 of this combinations. The pause. Weak, weak, weak. Strong, weak, weak. It's the stomach and hands. And mostly here. This one is weak, strong, strong. The strong pause at the bottom of the, when you touch down, ooh, wow, so strong a rebound. Then you know there's something in the abdominal area, and the leg, knee, ankles, feet are all under some kind of inflammation. But today we only talk about the kidney. Kidney pause like this: weak, strong, weak. This is very interesting. When you even when you press down all the way down, the pause disappeared. There's no rebound at the bottom of the pause. So that's kidney. If you feel that, you don't have to feel it on the chi. You can directly feel on the cun guan anywhere. If this kind of weak, strong, weak pause appears, then it's kidney problem. Then what do? We do something else. Okay, let's go back to this. So then you can tell there's a kidney problem. As for the ear, it's in here. This area is the kidney area. This one is not very clear. Now this one, see, everywhere is a little dark. Only the kidney area is so pale. That means there is not enough blood through the kidney. When the blood circulation through the kidney is limited or diminished, that means kidney function is low, and the number BUN might go up. Oh, this one's different. So this is the kidney stone. There's some different story, huh? So this is for real kidney, for in the urination system, not for reproductive system, not for sex hormone or something. This is real kidney. And I developed a very interesting combination. Thanks to Tina, I got this. Yu Dun Cao. It's an herb from Taiwan, and it's very good for many, many things. Water retention, frequent urination, the kidney function low, kidney function, there's a formula, I'll tell you later. And for the water retention, even for cancer. So Yu Dun Cao is a major ingredient in this combination. Yi Mu Cao, as you know, Yi is good for mother, Mu is mother. So actually, usually we use this herb for the period and the blood retention, blood stagnation in the uterus for little chappy ladies for the not coming period. So how come we use it here? Because it will enhance the circulation of the kidney and lower the urine in the urine. So Yi Mu Cao is not only for female part. I use it very good for kidney function to resume the kidney ability. 阁下煮鱼汤, Ge means in the middle. Can you see it? Okay. This is the upper part for I use 血府煮鱼汤. In this middle part, I use 阁下煮鱼汤. This middle part, the kidney actually is in the middle part. So I use this. And this one, I use the problem in here, I use 少妇煮鱼汤. So 阁下煮鱼汤 to clear the stagnation in this area. So this area is the kidney area. And it will help the blood flow much better. Or sometimes you can use kidney stone formula. Help to reduce, to reduce the water retention, to release the pressure of the kidney, so kidney can function better. as for the 贵妇地黄丸, there's another story. I was working with a bunch of doctors, Chinese doctor and Western doctor in Taiwan, one Sanjun 3 military hospital, general hospital, 3 general military. They have a problem with treating the kidney function. A lot of young soldier got a problem. Maybe it's from dehydration in hot days. They call it's called nephrotic syndrome. Nephrotic syndrome is the degeneration and allergic reaction or immune system deficiency causing 4 simple, very clear symptoms. First, heavy edema. Secondly, very high cholesterol. The third one is a very low albumin. The blood protein is lost because the urine, the high protein in the urine. And at that time, I was using something like this. But majorly, after some study, 贵妇地黄丸 is good for urine. What do you call it? The protein in the urine. Most the patient with the kidney function, their protein might be 4+. It's very difficult to treat. But anyway, the Western doctor was so consistent. They were so stubborn. They insist using steroid, prednisone. Prednisone, they use up to 150 milligrams a day. And finally, those young soldiers got osteoporosis and the damage to the feet bones and the hip bones. They have to sit on a wheelchair for the rest of his life. That's very sad and pathetic. So we use this. My result was pretty good. Even I was very, very young at that time. 贵妇地黄丸 can be used to tonify the real kidney function. Okay. Seems so many questions. How does the bone combo compare to osteo? I don't know that it's really. All of these pauses are like whoosh, no definition. Even in the, I don't know what that means. Okay, never mind. So there's a very interesting formula you can use to calculate the patient's kidney function. Let me do this. Okay, that's a very interesting formula, Okay, 140 is a constant minus the age times body weight. Body weight is in kilogram, not in pounds, so you have to calculate. And divided by creatine number times 72. 72 is also a constant. So the result is the clearance of the kidney function. It must be over 50. It better be over 15%. If it's under 10%, the dialysis is inevitable. So you might want to keep this formula by your hand. By your desk. So if patient, so in this formula. The only thing matters much is this number, creatinine. So the normal number of creatinine is 1.5 and better be under it. If it's more than 4 or 5, then it's very difficult. Maybe it's too late. So whenever a patient asks you about the kidney, when you find some kidney problem with that, and then and with that kind of pause like this, if they have the creatinine number, that would be the, I always tell them, let me calculate your kidney function. And if it's over bigger than 15, then it's fine. If it's less, around 10%, then we have to try harder for that. And also with the kidney failure, people always anemic. They're so pale. And pale with high blood pressure, very high. Looks like a very different way. The low iron or something in low protein, I mean the low albumin in the blood to make it so anemic, and blood pressure can be sky high over 180 or something. So how do I know it's there's a anemic? Here, can they see it? When I see the patient in the first beginning, I always ask them to show me your palms. If you this area, you don't have to see the eyelid or something. If this area looks so pale, then you can tell it's anemic. So that leads to another conclusion. You should have your patient's blood pressure taken before you see them. When they enter your clinic, you ask your ladies to take their blood pressure. If you find the blood pressure is something around 160, 180, and then with anemic signs, look here, then you have the idea that's kidney failure. Okay? Then this is the best combination I can think of. And they might have edema. How do you know there's edema? Or maybe not this by touching the leg, the inside of a leg, like the spleen channel, kidney channel, and the combination, the conjunction of the liver channel to press down. They might have a very swollen leg. And how do you know they have a very strong high cholesterol? Is around those finger joints. If you see some blue lines there, that's the cholesterol. So this is the best combination I can think of. You can use either of them. You can add this or not, or this is good. And definitely this one is the leading actor of this combination. So you might want to use like at least 40%. And the rest of them just adjust it accordingly, okay? Any questions? Should you use 阁下足鱼汤 with kidney failure? That's what I'm saying, 阁下足鱼汤. Here. 阁下足鱼汤 here. Okay, then let's get the conclusion. There are several ways of deciding the kidney problem. First, blood pressure is extremely high. Secondly, the patient is so anemic. Thirdly, they have a water retention on the leg, maybe not. Third is the pulse. The pulse is like this. And the last one is the ear point, okay? So, This section is the kidney area here. You might see something like an island, like some of the spot or just pale or something, then it's the kidney problem. They must have some symptoms in urination and things like that. Okay, any questions? Oh, okay, there are two, I'm just showing you here. This is the cancer sign. You draw a line from the button of the eye and button of the nose, and you see something strange here. It's supposed to be here, yeah. It's the red one and the black one are all bad. So this might be some kind of a cancer, huh? So it's here, this one. From the bottom of the nose and the corner of the eye. You see something like that is not really good, okay? Okay, again, this is the kidney for low kidney function, kidney failure. This kidney got nothing to do with reproductive system, nothing to do with sex hormone. It's just pure, the organ is not functioning. And oh yes, the EGFR will be very low. And calculation, remember the formula I mentioned about? You can calculate this and ask the patient to present you his blood test. The EGFR must be very low. But after treating this, it will go up because the kidney function will be resumed by your treatment, okay? Can we save this, my typing?
Yeah.
How do I do that?
Oh, just like keep going, and then like it will save.
It will stay?
Yeah.
Ah, okay. Again, this and this is the something. Let me. Okay, this one. This is the kidney area, so pale. That means not enough blood supply through the kidney. Kidney is working like a filter in the house, a water filter. So the filter is blocked, or not enough blood, not enough water through it. So the function is just low. And the one number, blood urine might be high. Oops. Okay, BUN might be very high, over and become 20, 25, 40, 50. That means the kidney doesn't have enough blood supply. That's why I use the 给下煮鱼汤 and 益母草 to push more blood through it, and also the 油炖草. And okay, this area is the hip. See the darkness in the hip? That means there's some old injury here too, the hip. And this is the thyroid. The thyroid, the darkness of thyroid means circulation is slow. This patient also might have some water retention. And this is the inner ear. See here? Inner ear is this balancing mechanism in the inner ear. That means the darkness means blood stagnation. Like I mentioned earlier, and not today. One of my students asked me to go to the hospital to see his aunt or something, because the Western doctor diagnosed the lady's vertigo, severe dizziness was some blood stagnation in the ear. So they gave her the blood thinner or something very strong blood stagnation movers. Then she started bleeding from a vaginal area. Before I can fix some kind of a black medicine to stop the bleeding, she passed away. Oh, that's it's an innocent, unnecessary. So, but anyway, the theory was correct. There's a dead blood in the inner ear will cause vertigo. Of course, our blood mover is not that strong. We can use it with my resolve lower, sister breaker, or even 血府煮鱼汤, combined with my vertical combo. My vertical combo is very good for this stuff. And this, see the darkness there? It looks like there's some kind of skin problem, but actually this area is the testicle. So if this guy or the lady want to get pregnant, we must clean the abdominal blood stagnation by using resolve lower, my sister breaker, my hot breaker, my cold breaker will do that. And all those breakers we talked about earlier in the previous class in June, right? Okay. Okay. When the blood pressure, okay. When the blood pressure is very high, huh? This is my combination for missing one. Okay, this white one is part of the ingredients for kidney type of hypertension. That in addition to the being anemic and very high blood pressure, they also have a sign is here. It's the Shaoyin pulse here. This artery can be very big and strong. You have to, no, it's in here. In this area, this HT12. HT2, okay. Anyway, it's in here. So I'm gonna tell you something very, very important. This kind of high blood pressure, I call it hidden hypertension. Why is it called hidden hypertension? Because when you check the pulse for normal arteriosclerosis, people with hardening vessels, the pulse can be big, strong, expanding, and very hard to press down. You can hardly push it to nothing. It's very strong. No matter how strong you push it, it can be still strong and with very, very indestructible rebound like this. So that blood pressure is definitely high. But in this kind of a hidden blood pressure, the pulse can be very weak. Very weak, very weak. You might make a mistake because the patient keep complaining, "Oh, can I do for you today? I'm so tired, please help me." And you check the pulse, oh, it's so weak. Okay, let's tonify it. Let's give it some 黄芪健中汤, 十全大补, all the tonifying stuff. Then the blood pressure will be sky high. It's very dangerous. This is called peripheral stenosis. Peripheral means the small ends are close, not only here, but also in the kidney. That is in this condition. Usually, this is the blood vessel from thick to thin. Gradually changes. But this peripheral stenosis, it goes like this. The sudden change of the diameter. So the blood flow got stuck in here. And the downstream doesn't have enough blood supply, so limited, so the function start going down. This condition, if it appears on the arm, on the leg, or somewhere else, the pulse can be peripheral pulse, can be very weak, give you a wrong impression that the patient is weak. And besides that, like I said, this patient might be anemic. So his face can be so pale and so tired, so swollen. Naturally, you would think of giving something to tonify his body. Then you're wrong. I made the mistake several times also. But okay, this condition might be also in the arm on the extremities. But the worst condition is this kind of blood vessel, the diameter changes inside the kidney. That's the most fatal and deadly condition. If inside the kidney, the blood flow is so limited to the peripheral area and the function naturally goes down. So what we do is to open it up by 益母草 and the 桂附地黄丸 and 优炖草, as I mentioned before. So what I'm trying to emphasize here is that when you take the pulse, generally, you might feel the pulse is so weak and the patient looks so pale on the face. And his major complaints, I'm so tired. He will not talk. He will not tell you he had a blood test of the kidney function. He just wants you to help him get rid of the tiredness, general fatigue. Then you naturally would give him some kind of a 黄芪健中汤, even 十全大补. Then the big mistake will occur. So that's why sometimes I emphasize this. You take your blood pressure, patient's blood pressure before he's sitting down in front of you. Ask your lady to take blood pressure before the patient's in your office. Okay, that's very important for protecting the patient and for protecting yourself. Any questions? This is called peripheral stenosis. Not this one. This one. Sometimes I use an opener. Opener we mentioned earlier in August class or something. Okay, no question? Oh, for the white one, I use this because I see some kind of water retention and the 咸丰草水丁香 for water retention. And I was also use the 川牛膝 川牛膝 and the 郁金. I don't know how to spell it. Chuan Niu Xi. Okay. And Yu Jin. Yu Jin. Okay, let me tell you something good about this one. Yu Jin. There are several uses for Yu Jin. Yu Jin is for the gallbladder and liver condition. It's also good for emotional disturbance with the so-called liver fire. When you take the pulse, the left guan, can you see this? Okay. The left guan is stronger and convex like this. That we call the liver fire. Liver fire means emotional disturbance, stress, and things like that. If the left guan is like this, the middle part, the rebound of the middle section is low, 寸 and 齿 is high. This is anxiety, and this is stress. Okay, so 郁金 is good for not only for the gallbladder area, but also for kidney function. If you don't have the kidney stone formula, you can use 1 郁金 to replace it. See how good it is? So I use it a lot for lowering blood pressure. So 川牛膝 and the 郁金, you can put them together with this. Okay, and for a little bit slower result, for long-term use, you can use 玄. I wish Tina is here. 玄参, something like that. The black 参 is because the taste of the 玄参 is sour and cold. Sour and I'm sorry, not sour, salty. Is salty. Salty things can soften the hard stuff. So 玄参 for long-term use can soften the hardened arteriosclerosis and anything in the blood vessel. And it's cool and it's black. When it's black, it goes into the kidney. So that's a good herb for long-term use. It's very, very, very safe. No any side effects. Okay, any questions? Shen, oh, sorry. I hate pinyin. Okay. We're gonna keep on with the class. If you want to take break, you go ahead. Have a beer. No. Okay, we stop a while. My director has something to do. Okay.